Hi, my name is Sumit Desi, and the topic that I'll be presenting on is cardiovascular disease and how it relates to public health. The problem very much so exists in society. It's the leading cause of death for both men and women in the United States. About 610,000 people die of heart disease in the United States every year, making it 1 in every 4 deaths. And about 3.7 million people go to the hospital every year for heart disease, and the average stay is anywhere from 4 to 5 days. How cardiovascular disease happens. Plaque builds up in walls of arteries, making it tougher for blood to flow through. And if this blood flow is restricted so much, then a clot can form. And these blood clots can lead to heart attacks or strokes. And heart disease is everywhere. It's worldwide, it's global, it's one of the leading causes for deaths for both men and women everywhere. Over 80% of heart disease deaths occur in low and middle income countries. Future risk. Cardiovascular disease runs in families. If a close relative suffered from cardiovascular disease, then one is at an increased risk for developing the disease as well. To combat this, individuals must take preventative measures, which may include increasing physical exercise, could be picking up a sport, simply just walking or weightlifting, anything, some sort of physical exercise, refraining from a sedentary environment, not smoking, having a clean diet, and not drinking alcohol. Number 5, people with diabetes or a poor diet or a lack of physical exercise, excessive alcohol use, or obesity are at increased risk of heart disease. Some factors that feed into these aspects but are not limited to are smoking and consumption of red meats. How to solve this problem? The first strategy is to eat a clean diet. You cut down on the amount of fats you intake and cholesterol, foods like eggs, milk, and meat, especially red meats, and you eat foods high in omega-3 fatty acids. These foods include walnuts, salmon, tuna, avocado, foods like that. Strategy 2 is that there's no cure known for cardiovascular disease, but it is treatable through changing your lifestyle. Like I mentioned before, quitting smoking is a big one, as tobacco use has a high correlation with heart disease. You should exercise regularly, even if it is as simple as a brisk walk, 30 minutes a day. That makes a difference. Anything is better than nothing. Number 2, the historical example is the Framingham heart study that we learned about earlier this quarter. In the early 1940s, heart disease was the #1 killer in the United States. Not enough research was done on understanding the control and the treatment that goes into heart disease. There wasn't a widespread prevention programs or education programs about the risk factors correlated with heart disease either. So this study gathered the knowledge of the roles that diet, exercise, and other lifestyle choices play in heart disease and how they can help prevent heart disease. Another historical example is how people used hawthorn in the early 20th century to essentially relieve heart pain and cardiovascular disease. People believe that when the heart muscles seem to be aging, which is what they called heart disease, they used hawthorn leaves for their antioxidant compounds, which would increase blood flow and maintain healthy blood pressure while relaxing artery walls. This is just like a home remedy that people used, and it isn't proven to work by any means. Preventative measures, public health in the future. So an aspirin a day. In order to prevent cardiovascular disease, research says that men of the age from 45 to 79 years old should take an aspirin a day, and women who are 55 or through 79 years of age should as well. Research also states that risk of cardiovascular disease in men and women can be reduced by not smoking, by having an active lifestyle, and avoiding overweightness and obesity. Also by having healthy amounts of blood pressure and blood cholesterol, which essentially goes hand in hand with your diet and active lifestyle and essentially smoking as well. My opinion is that I think that lifestyle changes are the very best way to prevent cardiovascular disease. Um, these changes may include, but are not limited to, exercising more, not smoking, and eating a healthy diet. Um, Not only cardiovascular disease, but also these, if you follow these three things along with other ways to live a healthy life, you're generally going to reduce your risk of other diseases, not just heart disease. Um, you should also make an extra conscious effort, in my opinion, to reduce your risk of cardiovascular disease if you know that the disease runs in your family. One way to do this is using the health belief model that we learned about earlier this quarter, where you acknowledge that you're vulnerable to the disease because it runs in your family. Everyone knows that it's serious, it's life-threatening, and you take action to protect yourself, whether that be changing your lifestyle altogether, making simple changes, or continuing your lifestyle if it is healthy and you're following these preventative measures that are proven to work. This is a list of my references, and there are 2 pages here, and that is the end of my presentation. Thank you very much.